We're moving up to the shoulder now, and muscles that have movement primarily at the shoulder joint. We're going to start today on the anterior side with Pectoralis Major, large superficial muscle on the front of the chest. Your origins for Pectoralis Major are going to be the sternum, so this is your sort of your medial portion here. Also the cartilage of the first 6 ribs, and this medial half of the clavicle. So this is kind of your origin, if you will. The fibers are going to run kind of out towards the shoulder, and they're going to insert on the crest of the greater tubercle, which is about here. You will remember that there's 3 fiber directions. So your upper fibers are going to kind of run downward in this fashion. Then your middle fibers are going to come sort of straight across. And then your lower fibers are going to kind of move in an upward direction. So for purposes, when you are showing this muscle, you're going to kind of cup your hand and show medial clavicle, sternum, and the cartilage of the first 6 ribs, crest of the greater tubercle. Kind of open your hand in this fashion to represent the different fibers. Pull your hand outward, pull your fingers together, out to the greater tubercle. So for palpation, we will need to see you palpate this in 3 places. So if we, in palpation, remember that we have to palpate across the fibers, with these fibers coming in this direction, I need to stand with my finger pads against the fibers in this direction. I'm going to palpate first of all towards the client's opposite ASIS. You'll want to be a little bit closer to the axilla as opposed to being over here. Reinforce your fingers for good body mechanics. Sink into the tissue and palpate, and you'll just kind of feel the muscle flip. You can see it flip right there. For me to verify that, what I'll do is have my client kind of push their hand into their hip, which is adduction, and you'll see how it kind of pushed me out. So he'll relax. There are the upper fibers. For the middle fibers, I'm going to just kind of move my hand down slightly, but I'm going to point my fingers to the same side ASIS, because these fibers are coming across in this direction. So again, I'm a little bit lower, and I can catch the middle fibers right here. And then last, for kind of all of the muscle, including the lower fibers, I'm going to just step back facing my client's head, have him push into his hip again to see the muscle contract, and then just use a pincer grasp from the side and you catch the entire muscle here. He'll relax, and then I'll just use that pincer grasp to show all of the muscle at once. If you are palpating on a female client, it would be best for her to bring her opposite arm and just kind of hold breast tissue down so that you can palpate in these 3 positions. Staying with the muscles that have some type of action on the client's shoulder, we're going to focus on Latissimus Dorsi, which is the broadest muscle on the back. It's a very interesting muscle that has 5 origins and 1 insertion. The muscle basically is going to cover most of the back, run under the client's arm through the armpit or the axilla, and then attach to the front of the shoulder. So for purposes of palpation and showing palpation, you're going to start with your hand closest to the client's head, laying on the back, kind of in a horizontal position, and then your hand closest to their feet, you're going to put at kind of an angle pointing towards their glutes, if you will. So the muscle will run up, you'll kind of pull your hands together, tell us that the muscle runs under the armpit, and then it attaches here to the front of the arm at the intertubercular groove. So if I were to draw the muscle so that you can get a visual of it, you've got to make sure that you are below the inferior angle of the scapula, because if we're up here on the lateral border, we're going to be hitting the teres muscles. So the fibers basically are going to run really large. You're going to have a big expanse. Such as this. So your origins then are the inferior angle of the scapula, the SPs, or the spinous processes, of the last 6 thoracic vertebrae. It's going to be the last 3 or 4 ribs. This diamond shape, I'm kind of representing the thoracolumbar aponeurosis, that big sheet of connective tissue, and the posterior iliac crest. So again, if we put our hands here like we first did, we're mimicking those fibers running this direction and under the arm. So one of the things or actions that this muscle does is shoulder extension in this fashion. So if I held the client's arm down and asked them to extend their shoulder, you're going to notice how the muscle tightens up right here. He can relax, and then the muscle kind of loosens. The best way to locate this muscle and to show your palpation is a pincer grasp. One of 2 options. You can bring your fingers up and your thumbs underneath and just come in again. Be sure that you're below the inferior angle here. And just pick the muscle up, squeeze between your thumb and fingers, and kind of pull your fingers towards you, and you're going to get a small kind of pincer grasp, and you're going to just kind of pull the muscle off, and you'll get a little bit of a flip. You've got to kind of dig in to get to it, but you'll feel it right here. Other option is to have your thumb on top, fingers here, and you can see how if I go in deep enough and pull kind of out, that I've got a small flip right here. That's what you've got to get, is that flip to show that you're on lats. Teres major is also known as lat's little helper. So it's going to do the exact same actions as Latissimus dorsi. So I drew in lats, of course, and here's the inferior angle of the scapula. So remember, we find the inferior angle of the scapula with this kind of webbing of our hand, and I just kind of come in around it and kind of push towards their head. So this finger's on the medial border, here's the inferior angle, and here's the lateral border, right here where my thumb is. So teres major, or lat's little helper, its origin is the inferior angle of the scapula and the lower 1/3 of the lateral border of the scapula. This muscle will run under the arm and attach to the front at the crest of the lesser tubercle. So to find it, to show for palpation purposes, again, just bring this hand in, cup around the scapula, and tell us that it starts at the inferior angle and lower 1/3 of the lateral border, runs under the arm, and attaches here at the crest of the lesser tubercle. At that point, I would bring the client's arm off of the table, because one of the things that action-wise that teres major will do is internal rotation at the shoulder. Okay, internal rotation. So for the muscle to pop out really well, I'm going to just place my lower leg in front of my client's palm. Once I have placed my hands around the scapula, right here you're still going to feel bone. So that's not the muscle that I want to find. That's bone. So I do want to bring my thumbs kind of more up into the soft tissue here. I'm going to ask my client to push into me. You'll notice how the muscle really gets tight right here. He can relax, and then I can just use my thumbs and palpate kind of up towards his head basically, and I'm going to be on teres major. Now the one point I want to show you is here's where teres major is. Lats is down here. So you've got to make sure that you differentiate between lats here and teres major here. And again, the client can push into me. It tightens up right there with internal or medial rotation, and then using good body mechanics, just use your thumbs and flip across the muscle there. Last muscle that we're going to look at today that moves the shoulder is deltoid. Deltoid you'll have to palpate in 3 places because there's 3 different fiber directions. There's an anterior, middle, and posterior fiber. So to show it on the client, I'm going to kind of mark it for you first. It's going to be the lateral third of the clavicle, the acromion process, and the spine of the scap, which is right here. You'll remember it's that portion of the scap that we can palpate in an oblique fashion coming up this way. And then the fibers are going to run down and attach to the deltoid tuberosity, which is about here. So to show, on palpation purposes, to show how this muscle runs, you can take the webbing kind of your thumb and finger, kind of a cup, and basically just put it right on the shoulder, and you'll get all 3 origins at once. You'll get the lateral third of the clavicle, the acromion, and the spine, all in kind of one motion. Then you'll show deltoid tuberosity, and this is a muscle that the fibers kind of look like a teardrop as they come down the arm in this fashion. So you're going to have to move around the shoulder to get the 3 different fibers. Remember that they all abduct the shoulder. So if I held my client's elbow and asked him to abduct his shoulder, you can actually see the outline of the muscle here. Anterior, middle, posterior fibers. So I'm going to come to the front of my client, and again, here is pec. Deltoid, anterior delt, is going to be on this lateral side of where you'll find the armpit. It's going to be on this side, whereas pec is on that side. So I'm going to come in and kind of just rest my fingers on the client's shoulder, and I'm just going to use my thumbs. And anterior fibers, again, all the fibers abduct the shoulder, but my anterior fibers will also flex the shoulder as well. So if I want to isolate those in particular, I can hold the elbow and ask my client to flex their shoulder, and the fibers are going to get hard right there. So I'll have them relax. There are my anterior fibers of delt as I flip across them. Then I move to the side, not too far from those fibers. Put my thumbs together, and I'll go back and forth, and there are my middle fibers of delt. And if I'm not certain, I can keep one thumb there, a hand on the elbow, and ask my client to abduct. You'll notice it kind of pops my thumb out. Those are the middle fibers. And then to catch the posterior fibers, I'm going to come to the back. That's why we're having the client sit basically on the corner of the table, so we can move around the body. So you want to make sure that you're below the spine of the scap in this area here. So again, I'm going to just rest my fingers on the client and just use my thumbs. Now, posterior delt also does extension of the shoulder. So to verify that I'm on it, I can leave one thumb there, put one hand on the elbow, and ask my client to extend the shoulder, bring it backwards. And I know that I'm on it right there, and then bring both thumbs in, and you can see I kind of flip across posterior delt there. So you'll need to do it in anterior, middle, posterior fibers.